Good day and welcome to today's video productions on Mature Healthy Life Video Talk or Health Talk. Our topic today is complications of epilepsy. In our last video we talked about the signs and symptoms of epilepsy, and that brought us to today's topic, complications of epilepsy. One of the complications of epilepsy is accident. Yes, an individual with epilepsy can fall into a victim of accident out of confusion or unconsciousness. One with epilepsy can unexpectedly fall into an oncoming vehicle, or fall into a fire, or fall into any danger within and his around or surroundings. So that is one of the complications, accident. Another one is concussion. Concussion is a sudden loss of consciousness. Unexpectedly you lose consciousness. It's also a complication of epilepsy. Another one is difficult learning. Individual with epilepsy finds it difficult to learn because the electric activity of the brain is being tampered. The memory is no more balanced. It's no more as it's supposed to be. So there'll be difficulty in learning. Another one is loss of consciousness. Yes, loss of consciousness. With time, epileptic patient or epileptic individual can lose consciousness and lose control of his environment. That is also a complication of this condition. Another one is mood problem. An individual with epilepsy can sometimes be moody. Yes, when you see him or when you observe him, you see that he is moody without any apparent reason. It is also a complication of epilepsy. Another one is muscle spasm. Yeah, there will be an involuntary muscle spasm within the area of the brain and the head regions, because this patient or individual with epilepsy does not have an absolute control of his system, especially within the brain region. So there could be an involuntary contraction of the muscle, call it muscle spasm. It's also a complication. Another one is permanent brain damage. Yes, individual with epilepsy, untreated one, can damage the brain permanently. Yes, he has a brain damage. Permanent brain damage is also a complication of this condition. Another one is pregnancy dangers. A person, a female individual with epilepsy, can have a danger in the period of his pregnancy. There can be, for instance, placenta abruption, because when an individual with epilepsy starts having the symptoms of epilepsy like jerking, like fibrillation, this can also trigger placenta abruption. That is the detachment of umbilical cord from the placenta. It's also a dangerous condition. It's also a complication of this condition. Another one is sleep deprivation. An individual with epilepsy finds it difficult to sleep comfortably because there is always an unexpected attack of this condition. Another one is drowning. Individual with epilepsy does not need to go into swimming because he can get drowned there. Out of whatsoever, he can start having attack within the swimming and get drowned. So it is also a complication. Another one is encephalitis. Encephalitis is the inflammation of the brain out of the infection that may have attacked the brain to initiate or enhance the electric activity of the brain from functioning very well. So this infection can also cause inflammation of the brain, which is encephalitis. It is also a complication of this condition. Another one is fast breathing. Fast breathing is also a complication of this condition because the services or the activities of the brain correlates with the heart functioning. So it also can cause heart fast breathing, which is also a complication. Another one is febrile seizure. Febrile seizure is temporary jerking or temporary seizure, temporary jerking of the body out of these epileptic conditions. Another one is hypoglycemia. Hypoglycemia is the reduced sugar level in the blood. It is also a complication of this condition. Another one is sepsis. Sepsis is a blood-borne disease. That is a blood-borne infection. When this infection that may have attacked the activities of the brain gets into the blood, it also attacks the blood stream. That is sepsis. It is also a complication of this condition. Another one is urinary and bowel incontinence. The individual loses the control of the urinary system and his bowel system, thereby maybe making stool when he does not want, or involuntarily or uncontrollably. He can also pass urine when he doesn't even want. He can't have the control of his urinary system and his bowel movement. That is also a complication of this condition. So my people, have you watched this video? Please share it, hit the like button, comment on the comment section, follow us on our Facebook page, Mature Healthy Life. Thank you so much as you share.